Hey friends, I wanted to take a minute to talk about something that's been coming up quite a bit recently, and that's how to show up for people we care about when they're going through something hard. That might be recovering from illness, facing treatment, preparing for or healing from surgery, or honestly just navigating a really difficult time in life. This comes up a lot in my work as a therapist, and it's something I've experienced personally too. In fact, just a few days ago, a friend asked me how I was feeling about my upcoming surgery this week. And at first, I gave my usual stock answer: I'm okay, I'm fine. But then they paused and said, No, how are you really feeling about it? And in that moment, I realized how much the way we ask and the words we use can make a world of difference. That one small shift opened the door for a much more honest, supportive conversation. So, here are a few things I've learned, both professionally and personally, about how to show up for someone in a way that actually helps. First, try not to lead with, How are you? I know it's habit, but that's a question that can feel really overwhelming, especially when someone's in the middle of something heavy. Instead, ask something more focused, like, How are you feeling today? Or is there anything specific you need right now? Or even, what's one thing that would make this day a little easier? These kinds of questions show care without expecting them to explain everything. Next, think about your relationship. If you're close, let it be natural. Speak from the heart. But if you're not as close, that's totally fine. You don't have to go deep. A simple, kind check-in like, I've been thinking of you. Can I support you in any way today? Or can I take something off your plate this week? Can mean more than you realize. Stay positive but grounded. Recovery, treatment, and illness can be emotionally draining. Something light, a funny story, a compliment, or just being present can really lift someone's mood. Even saying, It's so good to see you, matters. These little moments can shift someone's day without forcing a silver lining. Next, be specific when you offer help. Instead of, Let me know if you need anything, try something like, Can I bring dinner Thursday? Or I'm free Saturday, can I help with errands? Next, try to avoid dismissive phrases, even with the best intentions. Things like, You'll be fine, or Don't worry, can unintentionally minimize what they're feeling. Instead, go with something like, You're allowed to feel however you feel, or I'm here for you, no pressure, just support. And don't forget to follow up. Support that sticks around after the initial crisis or diagnosis or tough moment, that's the kind people really remember. A check-in 2 weeks or 2 months later shows love and care, not obligation. So whether someone is recovering from surgery, managing an illness and treatment, or just having a really hard time, your presence, your consistency, and your thoughtfulness go further than you know. You don't have to say the perfect thing. You just have to show up with care.